How is acute urinary retention managed? Have you ever wondered what happens when someone suddenly cannot urinate? This condition is known as acute urinary retention, and it can be quite painful. It is considered a medical emergency that requires immediate attention. The first step in managing acute urinary retention is to relieving the pressure in the bladder. This is typically done through a procedure called catheterization. When a patient presents with this issue, healthcare providers will first confirm the diagnosis. They may perform a physical examination and use imaging techniques, such as an ultrasound, to measure how much urine is in the bladder. This helps to identify any anatomical problems that could complicate the catheterization process, such as previous injuries or surgeries affecting the urethra. Once the diagnosis is confirmed, the next step is catheterization. A urinary catheter is inserted to drain the bladder. This procedure should be done by a skilled clinician to reduce the risk of injury to the urethra. If standard catheterization is difficult, alternative methods may be used. For instance, a caudate hip catheter, which has a curved tip, can help navigate around obstructions. In some cases, a cystoscopic guided catheter placement or suprapubic catheterization may be necessary. After the catheter is in place, it is usually left in for at least 3 days to ensure the bladder is completely emptied and has time to recover. After relieving the bladder, healthcare providers will work to determine the underlying cause of the retention. This could be due to conditions like benign prostatic hyperplasia, urethral obstruction, infections, or even neurological issues. To identify the cause, doctors may conduct urine tests, blood tests to check kidney function, imaging studies, and possibly refer the patient to a specialist. Depending on the identified cause, treatment options may vary. Medications like alpha blockers can help relax the muscles around the prostate or bladder neck. If an infection is present, antibiotics may be prescribed. In some cases, surgical interventions might be necessary to relieving any obstructions. For patients with neurological causes, teaching them how to perform intermittent self-catheterization can be an effective long-term management strategy. Monitoring is crucial after the initial treatment. Patients need close follow-up to ensure their bladder function returns to normal and to prevent complications such as urinary tract infections or bladder damage. It is also important to consider that urinary retention can sometimes be caused by pelvic malignancies that obstruct the urinary tract. Therefore, thorough evaluation is essential to rule out any serious underlying conditions, including bladder cancer. In summary, managing acute urinary retention focuses on quickly relieving bladder pressure through catheterization, assessing the cause, and providing appropriate treatment. If you or someone you know experiences symptoms of acute urinary retention, seeking immediate medical care is vital for effective management and to maintain bladder health.